this is Dr. David Schiller, and today we're going to be talking about one of the major thyroid patterns. There are 30 different patterns, and one of which will actually respond to your hormone replacement. So for many of you, that is why you're not responding to care. So this pattern that we're going to talk about is what is called underconversion. So for a little bit of a review, if you remember from previous video posts, we talked about how TSH is what is being released by the pituitary to talk to the thyroid. And then we also talked about how the thyroid produces T4 and it produces T3. 93% is T4, 7% is T3. T4 is inactive, T3 is active. So the T4 that is produced, most of it is going to be wanting to be activated by getting converted to T3. We talked about how the T4, T3 conversion occurs in your liver 60% of the time, your intestines 20% of the time, and the rest of your body tissues another 20%. So there's your 100%. There is a portion of T4 or T3 that's produced that's called reverse T3. So again, if you're not checking for what is called reverse T3, you're missing out on a lot, because if there's too much reverse T3 is a totally inactive form. It's never activated. So if you have too much of reverse T3, that could be why you're having a problem. Reverse T3 could accumulate due to, or one of the things that it can accumulate due to, is cortisol or stress hormone. So when we're talking about underconversion, in other words, you're not having enough T3 from the T4, either because maybe the liver's not functioning well, or maybe the intestines are in a state of dysbiosis, or they don't have enough good bacteria, maybe there's parasites growing or yeast overgrowths. But in essence, if you're not getting a conversion from T4 to T3, then you're not going to get better by taking T4 replacement. So the idea is, do you have too much stress? Is your liver malfunctioning? Are the intestines malfunctioning? And these are the things that need to be looked at. And if they're not being looked at, that is why you're not getting better. So underconversion is one of the major patterns, and there's different reasons why it doesn't convert well, whether it's the liver, the GI, or you're making too much reverse T3 due to stress, or you're having other issues because of other hormonal imbalances. Do you have blood sugar imbalances that are causing the stress, old injuries? Are you having other types of problems that are not allowing that conversion to occur? So keep that in mind when you're thinking about why you're still having symptoms even though you're being treated, and I hope to give you some more information in the very near future, so make it a great day.